There it is, staring right back at you every single time you look in the mirror. A tiny, annoying whitehead, practically begging you to touch it. You feel the overwhelming urge. You lift your fingers, squeeze with all your might, and then you hear it. A split second of pure satisfaction. But behind that instant relief, you have no idea that you just triggered a biological chain reaction under your skin. Today, we are taking you on a cinematic, microscopic journey inside your skin to reveal what dermatologists really say. Should you ever pop that pimple, or are you secretly destroying your face? To understand why dermatologists practically beg us to stop squeezing, we first need to understand what a pimple actually is. Your skin isn't just a flat surface, it's a living, breathing ecosystem. Beneath the surface lie millions of tiny factories called sebaceous glands. Their job? To secrete natural oils that lubricate, waterproof, and protect your skin and hair. But sometimes the system fails. Dead skin cells and trapped bacteria clog the pore. With nowhere to go, the oil builds up like an expanding water balloon, pushing against the skin surface. This intense pressure is exactly what causes the redness, swelling, and throbbing pain you feel. But it gets riskier. There is a specific zone on your face that medical professionals literally call the danger triangle. It sounds dramatic, but the anatomy behind it is dead serious. The veins running through this area have a direct line of communication back to your brain, specifically the cavernous sinus. If you pop a severe pimple in this triangle and introduce a vicious bacterial infection into the bloodstream, it can, in rare but documented cases, lead to a septic infection or blood clots that travel straight toward the brain. That's why when it comes to this zone, dermatologists say, hands off. So, if popping is out of the question, what should you do when a massive blemish shows up right before an important event? Your ultimate weapon is actually the hardest one to use: patience. Dermatologists point out that acne affects over 80% of people at some point. If you leave a pimple alone, your body's incredibly efficient immune system will naturally clear it up and heal the area within a week. Zero scarring attached. But if you need to speed up the process safely, here is the official dermatological checklist. First, use hydrocolloid pimple patches. They act like a sponge, gently pulling out the fluids while keeping your fingernails away. Second, apply targeted spot treatments containing salicylic acid or benzoyl peroxide to dry it out from above. And third, apply a clean, warm compress to increase blood flow and help your body dissolve the clog naturally.